Let us go through the blood collection procedure for the 22 milliliter PRP kit. Before getting started with any blood draw procedure or handling of blood, apply single-use exam gloves to avoid cross-contamination and risk of exposure to blood-borne pathogens. The components of the 22 milliliter PRP kit should be taken out of the box and laid out on a clean work surface. Place the blister tray containing the PRP tube on a flat surface and gently peel off the Tyvek lid. Hold the tray face down and carefully push the tube out of the tray onto the work surface. Open the sterile packaging of the blood collection set by tearing the small perforation at the bottom right-hand corner. Once packaging is open, carefully drop the blood collection set onto a clean work surface. Place the PRP tube into the tube holder of the blood collection set. Do not puncture the stopper. Set aside while the suitable vein is located. Apply a tourniquet approximately 3 to 4 inches above the selected site for venipuncture. Do not apply the tourniquet too tightly and ensure it does not stay on for more than 1 minute. Tying the tourniquet too tightly or prolonged use may cause hemolysis or difficulty with filling the tube. Identify a suitable vein for the blood draw by carefully inspecting the patient's arm to find the best site. If the vein feels bouncy as you press on it, you have found a good site to work on. Once the venipuncture site has been located, prep the area by cleansing with an alcohol swab for 30 seconds and allow to completely air dry for 30 seconds. While allowing the venipuncture site to dry, remove the protective needle cover of the butterfly needle by holding the butterfly tabs with one hand and carefully removing the cover over the needle with the other hand. Once the venipuncture site is dry, secure the patient's lower arm, below the site of the puncture, firmly to draw the skin taut and anchor the vein from rolling. Insert the needle at a 15 to 30 degree angle into the vein. Ensure the bevel of the needle is facing up. Perform venipuncture with the patient's arm in a downward position. If properly inserted, blood should flash into the line of the blood collection device. If there is no flash of blood, the needle has either not punctured the vein or the needle went through the vessel. Once a flash of blood is observed, push the PRP tube onto the needle within the tube holder, puncturing the tube stopper. Center tube in holder when penetrating the stopper to prevent sidewall penetration and result in premature vacuum loss. Hold the tube holder onto the stopper to ensure a complete vacuum blood draw. Remove the tourniquet as soon as blood appears in the PRP tube. Keeping the tourniquet on too long could cause red blood cell hemolysis or prevent blood from flowing into the tube. Allow the tube to fill to the stated volume and the blood flow to cease. The correct volume of blood is obtained when the blood reaches the fill line as indicated by the black line on the label of the tube, near the tube stopper, identifying the appropriate volume. Once the tube has been filled to the fill line, remove the tube from the holder. Gently remove the needle from the vein, applying pressure to the venipuncture site with dry sterile gauze until bleeding stops. Immediately perform inversions in order to mix the anticoagulant with the blood in the tube. To do this, gently turn the filled tube upside down and return it to an upright position. For proper mixing of the blood with the anticoagulant, invert the tube at least 5 times. Be careful not to shake the tube as vigorous mixing may cause foaming or hemolysis. Be sure to thoroughly mix the anticoagulant as inadequate mixing may result in clumping or clotting of platelets. Once clotting has occurred at the venipuncture site, apply bandage such as a self-adhesive wrap if desired.